Now, the Minister of Agriculture, Land Reform and Rural Development, Thoko Didiza, has convened an urgent meeting with the Free State Premier Sisi Ntombela. Also in attendance were the MECs for Economic Development, Small Business, Tourism and Environmental Affairs, as well as Finance and Department of Agriculture and Rural Development. The meeting follows the outbreak of foot and mouth disease in the 22 properties of Marquard and Bethlehem areas in the Free State. The meeting is aimed at soliciting the help of the provincial government and to explain the 21-day ban of movement of animals. Officials say that the measures will be reviewed on a weekly basis. The minister says that the meeting is important so that all spheres of government can work together to fight the spread of foot and mouth disease. The minister has already met with the premiers of Limpopo, KwaZulu-Natal, and next in line is the Premier of the Northwest Province. The minister has been targeting provinces that are mostly affected by foot and mouth. Currently, there are 22 open outbreaks in the Free State. The affected farms are located in two main areas, Viljoensgroen and Marquard, which with the most recent addition of the farm in the Bethlehem area. Now, these premises have since been quarantined and animals vaccinated. We're now joined by the Head of Department for the Free State Department of Agriculture Rural Development, Dr. Takisi Masiteng. Thank you so much indeed for joining us and welcome to the program.
Thank you very much, Mr. Ndoro and the viewers, and thank you very much for the opportunity given to the department.
HOD, if you could just give us a bit of background to this outbreak. We understand that it was reported in April 2022 in the Free State.
Yes, indeed. It was recorded in April after the movement of animals from Northwest. They were having an auction there to one of our areas in the province, which is Viljoensgroen. And after that detection, we were compelled as a province to put that area under surveillance.
So how bad is the situation now?
Well, the situation, I can say it is bad. As you know that no province wants to be seen as one of the provinces that had foot and mouth disease. It has now moved from Viljoensgroen. We had 6 farms which were confirmed foot and mouth positive. And now it has moved to Marquard, where 15 farms were also confirmed foot and mouth positive. But also this morning, we also received reports that other 3 farms were also confirmed around Marquard. And there is also 1 farm that has been confirmed or tested positive around Bethlehem.
Are you concerned with the proximity that you have to Lesotho's border that this can become a cross-border problem?
Yes, indeed. Remember, one of our responsibilities is to respond to the country and also internationally in terms of the outbreaks, if we have any. And as such, remember, Marquard is nearer to Lesotho. And one of the things that we have agreed upon, not to say we suspect any movement from Lesotho as such, but remember the minister has put in a ban on the movement of cattle. And as such, we have also agreed that we will have to also guard and put measures in place. And if we have to also put measures on the movement of feed, we have to do that. But we will be working closely with SABC to assist us with the roadblocks as well as traffic. We have also requested Northern Cape to assist us with their animal health technicians. They have deployed 12 already. We have also engaged the Department of Distia in our province to assist us with their vets with the civilians and the capturing, in fact, of the game animals to ensure that we curb as much as we can the outbreak of this disease.
Tell us a little bit more about this movement ban. 21 days, is that something that might be reviewed and extended? How do you see it playing out?
Yes, I don't think the intention is to extend, but the intention is to make sure that within 21 days, we curb as much as we can and we put control measures in place. So the idea is not to seek for extension, but is to ensure that within 21 days, we have managed to vaccinate all animals that have tested positive. As I'm speaking now, we have already tested more than 60,000 animals. It means what? All the areas that have been identified, except the new 3 that I've talked about, have already been vaccinated. So the possibility of those areas spreading more diseases are far less. But we are making sure that within 21 days, we must make sure that we have kept the disease and put it under control.
All right. This is not the first time foot and mouth disease has hit South Africa. So I'm assuming that we've learned a lot with the way that we've dealt with outbreaks before. Are you confident because of that history and that learning that this is something that can be contained?
Yes, I'm very much confident given the work that we have already done, and also the fact that the minister came to Free State today, visited the Premier, just to check the state of readiness and also commit the support to say if we have any challenges, we are here, we are more than willing to assist the province in making sure that we curb and we do away with this disease in the province. So I'm very much confident that we will be able to put measures in place and control the disease in the province.
We live at a time where people are concerned about viruses and diseases. I just wonder if humans need to be concerned about this outbreak.
No, thank you very much for that. There has been a concern to say, can we eat the meat from the animals themselves? Remember, what you need to do, the animals have been vaccinated. What you need to do is to debone, and you can eat the meat after. But that is not what you want, because there are other serious implications in terms of the export and so on, if your country has such a disease. But yes, indeed, we are doing everything we can to make sure that we lay the fears of our people, and also we are embarking on a number of awareness to make them aware of a disease and what measures they must also put into place, and the fact that they must not allow any animals coming into their places or any animals going outside their farms.
All right. I mean, this must come at a huge cost, not just to the province, but the country, I guess, when we are gripped by such a disease and virus. Have you been able to work out what this might cost our economy?
Well, yes, indeed. As a province, we also look at some of the calculations and look at how much this will cost us. But I can tell you, as a matter of fact, for the mere fact that we are unable to export, it affects the country a lot. For the mere fact that we are now at a standstill in terms of the movement of the animals, there are no auctioneers and so on, that affect food security. It also affects some of our farmers in terms of creating job opportunities. Remember, we have just moved from the COVID itself, which affected the country, but the sector was performing well. But now this outbreak, it means a lot. It affects the economy of the province and ultimately of that one of the country, because there are quite a number of provinces that have been affected by this outbreak.
HOD, Takisi Masiteng, thank you so much indeed for joining us and giving us an update on this situation. Thank you for your time.
Thank you very much, sir.
All right, that's the head of department, the Free State Department of Agriculture and Rural Development, talking about this outbreak of foot and mouth disease that's gripped parts of the country, and the Free State particularly hard hit at this time.